Welcome back to Studio 10.
We're here this morning in the beautiful city of Destin. Dr. Ennis joining us this morning here at Destin Plastic Surgery. And Dr. Ennis, this morning we're talking about hair restoration.
Absolutely. Good morning, Chastity. There's kind of two parts to hair restoration these days. There's the surgical side of things and the medical side of things. And it's important for everybody to understand that because I have lots of men and women that show up and they're already completely bald. There's many, many things you can do when people first start to see a little thinning of their hair. And one of the most important things that people realize is there is a medical side of things. It doesn't have to always be surgical.
And Dr. Ennis, as far as a age group is concerned, are you seeing mainly older clients or are you seeing younger guys come in?
Many young guys now, and they realize that there are some non-surgical options for hair restoration as well. So we see guys as early as 18, 20 that are predisposed to losing their hair and come in early to get on the medical treatment. And for some reason, some people's hair is predisposed to fall out. It's typically the hair that's on top of our head, whereas the hair that's on the back of the head is not genetically predetermined to fall out. So one of the things we can do surgically is move the hair from the back of the head to the top of the head, and it stays. It grows there. But it's a very simple outpatient procedure. In a couple hours, they've got a full head of hair back.
Well, as far as any pain is concerned, is there any?
Very little. It's the recovery is very quick. Most people are out and about the next morning with a baseball hat on. They may get a little swelling, but it's not much at all, and certainly they're back to work in 24 to 36 hours.
And you were telling me not only does this affect men, but also women.
It does. It certainly does. There are many, many women that suffer from hair loss as well. So in women, you typically see two different patterns. Unfortunately, we can't do a whole lot for the women who are thin all over. Really recommend they see their OB/GYN or their internal medicine physician because they ought to get their hormones checked. There's some things like low thyroid that can make women's hair fall out and become very thin. Simple replacement can have the hair grow back in. The other side of it is you do see some women with what we call male pattern balding, or they get thin on the top just like men do. These women are excellent candidates for hair transplant, and these are typically not related to hormones. So we do hair transplants in these women that are thin on top, just like we do in men, and they have an excellent result. Such as this lady here, you can see on the top, she's actually using some black dye on her scalp to make her hair look thicker. At the bottom, obviously doesn't need that anymore.
If someone's considering this, what would you tell them? If they're thinking maybe they're starting to see a significant loss, even at the beginning stages of it, would you tell them to come and talk to you?
Absolutely. If it's very early, any of their local physicians can prescribe the Propecia or get them started on Rogaine. Once they get to the point where they feel like they need some hair replacement, absolutely please come talk to us because it's a very simple outpatient procedure done right here in the clinic, couple hours, and they're on their way to a nice head of hair again.
And remember, Destin Plastic Surgery uses the most up-to-date surgical techniques, and they're focused on making their procedures they do convenient for their customers. If you're interested, call them today for a consultation. Their contact information is on our Studio 10 webpage. And of course, we appreciate them joining us this morning. And coming up, we're heading back to